There's a silent danger lurking in hospital hallways, a trap that too many seniors fall into. After the age of 70, some medical tests don't protect your health. They actually put it at risk, and yet, very few doctors will tell you to stop. Today, we're exposing the dangerous tests that older adults should avoid, tests that may do more harm than good. Segment 1. Why some tests turn dangerous. After 70, as we age, our bodies change in ways medicine doesn't always keep up with. A test that might be life-saving at 50 can become dangerous at 75. Why? Because every test carries risks. Radiation, false alarms, invasive follow-ups, even unnecessary surgeries. And when your body is more fragile, those risks multiply. Here's the shocking truth. Many seniors keep taking tests long after the benefits have faded. In fact, some experts argue that this medical over-testing is one of the hidden causes of declining quality of life in older adults. Let's start with one test that millions of people over 70 still take. Yet for many, the danger outweighs the benefit. Segment 2. Colonoscopies. After 70, colonoscopies are often recommended for cancer prevention. They can absolutely save lives in middle age. But after 70, especially after 75, the story changes. Here's the hidden danger. Colonoscopies carry a risk of bleeding, infection, and even perforation of the colon. Studies show that older adults are more likely to suffer complications than to actually benefit from detecting new cancers. If you've had regular colonoscopies up to age 70 and never had concerning results, many medical guidelines suggest you can safely stop, but very few patients are told this, and so they continue, risking hospitalization for a test they may no longer need. But colonoscopies aren't the only tests that can quietly turn from helpful to harmful. The next one might surprise you. Segment 3. PSA tests for prostate cancer. For men, the PSA blood test has been marketed as a lifesaver. Detect cancer early, treat it, and live longer, right? The truth is far more complicated. PSA levels can rise for many harmless reasons, and false positives are common. What happens next? Often, a biopsy. And for seniors, prostate biopsies carry real risks: bleeding, infection, and sometimes permanent complications. Even worse, many prostate cancers found late in life grow so slowly they would never cause harm. But once discovered, they can lead to aggressive treatments that damage quality of life, treatments that were never truly necessary. That's why several major medical organizations now recommend against routine PSA screening for men over 70. If you thought blood tests were always harmless, think again. Another routine screening can be even more misleading after 70. Segment 4. Routine blood work and overdiagnosis. Routine blood panels sound safe. Just a quick draw, right? But here's the overlooked truth. Every test result can trigger a chain reaction. Slightly elevated glucose? You may end up on medications you don't need. Mild thyroid changes? Suddenly, you're dealing with side effects from pills that were unnecessary in the first place. For older adults, small variations in blood chemistry are normal, but lab reports don't tell that story. They flash warnings in red ink. Doctors, under pressure to fix numbers, may prescribe drugs that cause dizziness, confusion, or dangerous interactions. Overdiagnosis through routine blood work is a silent epidemic, leading many seniors down a path of overtreatment instead of healthy aging. But blood isn't the only area where too much testing backfires. Let's move to one of the most common scans older adults face. Segment 5. Annual full body scans. CT and MRI. Imaging feels reassuring. Machines that can see everything. But here's the catch. Full body CT scans expose you to enormous doses of radiation. Over time, repeated scans may actually increase cancer risk. For older adults, the danger isn't only radiation, it's the incidental findings. Spots, shadows, or cysts that look suspicious but are harmless. Doctors call them incidentalomas. They trigger cascades of biopsies, surgeries, and endless worry. MRI scans don't carry radiation, but they share the same problem: too much information. And for seniors, that often means unnecessary procedures that never improve longevity. The risks aren't just in advanced scans. Even something as simple as a mammogram can turn harmful after 70. Segment 6. Mammograms after 70. For women, mammograms have been a trusted tool for decades, but past 70, the benefit becomes uncertain. Many breast cancers found in older women grow so slowly that they would never shorten lifespan. Yet the mammogram doesn't know the difference. Once a tumor is found, the pressure to treat is enormous. Surgery, radiation, chemotherapy. For a 75-year-old, these treatments may be more dangerous than the disease itself. Guidelines now suggest that women in their 70s and beyond should have a serious conversation before continuing mammograms. But far too often, the conversation never happens. And here's one test that almost no one questions, but for seniors, it may be doing more harm than good. Segment 7. Bone density scans. ADEXA. Bone density scans are designed to catch osteoporosis early. That sounds wise. Who wouldn't want to prevent fractures? But the hidden problem is overtreatment. A DEXA scan might label your bones as low density, even if they're still strong enough. The result? Powerful medications with side effects like jaw damage, digestive problems, and even unusual fractures. For many older adults, lifestyle measures, gentle strength training, vitamin D, and balance exercises are safer and more effective than pills triggered by a scan result. This is the trap. Numbers replace the bigger picture of health, and seniors end up on drugs that make life harder, not safer. And then there are the cardiac tests. Heart health is vital, but not all heart tests are wise after 70. Segment 8. Stress tests and heart imaging. Heart stress tests are often ordered for older adults, especially before surgeries. They involve treadmill exercise, nuclear imaging, or dye injections. But here's the risk. False positives skyrocket with age. A test that looks abnormal may lead to invasive procedures, angiograms, stents, or even open heart surgery. And while these interventions save lives in certain cases, for many seniors, they don't extend lifespan. They only add recovery time and complications. Doctors are now urging caution. If you don't have symptoms, routine heart stress tests after 70 may create more problems than they prevent. At this point, you may be wondering, if so many tests are risky, why are they still recommended? Segment 9. The hidden forces behind overtesting. This is where the story gets uncomfortable. Tests aren't just medical tools, they're also business. Hospitals, clinics, and labs make money from every scan, scope, and blood draw. Add to that the culture of defensive medicine. Doctors who order extra tests just in case so they can never be blamed for missing something. And finally, fear. Patients fear cancer, heart attacks, and hidden disease. Doctors fear lawsuits. The result is a cycle of testing that doesn't always serve the patient's best interest, especially seniors. The irony? Sometimes the most powerful step toward longevity isn't more testing, it's knowing when to stop. So how do you know which tests to avoid, and which ones you should still take seriously after 70? Segment 10. The smarter approach. After 70. Here's the bottom line. Not all testing is bad. Some screenings remain essential. Blood pressure checks, vaccinations, eye exams, and tests for real symptoms are still critical. The key is individualization. After 70, the question isn't, what does everyone my age need? Instead, it's, given my history, my health, and my goals, which tests make sense for me? This means talking with your doctor about risks versus benefits, not just automatically scheduling the same test you did last year. It also means asking the powerful question most patients never ask. Will this test improve my quality of life, or just create anxiety and risk? And here's the final truth. Avoiding unnecessary tests doesn't mean ignoring your health. It means protecting it. Closing segment. As we age, wisdom becomes our greatest defense, not only against illness, but against unnecessary medicine itself. Dangerous tests after 70 can steal peace of mind, time, and even years of health. But by knowing which ones to question, colonoscopies, PSA tests, endless blood panels, full body scans, mammograms, bone density scans, and routine heart stress tests, you reclaim control. The ultimate goal isn't just living longer, it's living better. And sometimes the most powerful decision is the choice to stop.